Prevention is very important for sun damage, and you really should start when you're young. And if you have children, you need to kind of make sure that they go out there with their sunscreen. I am not going to tell people not to go out in the sun. That's impossible. We all enjoy the sun. Sun has benefits. It has vitamin D that helps with our calcium absorption, so it's very important. But probably the biggest thing with sun is that you want to try not to get burned. So always having a good sunscreen on, wearing hats, not going out between the hours of 10 and 2, which is when it's the strongest, particularly in the summertime. Wearing sunglasses and just kind of overall being sun protective is important. Then once you've gone beyond the protectiveness, what happens when you start to see what are some of the signs of sun damage? Well, certainly as you age, you start to have freckles start to show up. Those freckles are an indication of sun damage. Again, sun damage can also be where you find fine lines and wrinkles in the face. You can actually have little broken capillaries in the face. And those are all indications of sun damage. And you can actually treat those. And again, going with some of the things that I've talked about previously would be some of the laser treatments, some of the skin peels, and then a good home regimen that may include and should include Retin-A, because it has been shown by research that does help to reverse some of the sun's damage. Of course, in your home regimen, a good at least an SPF of 15 daily, and you can find that in moisturizers even. Vitamin C, topical vitamin C is your antioxidant, and that's very important. That works more at a molecular layer where it actually gobbles up the free oxygen radicals, which are the kind of the decomposed particles of our skin on the molecular layer. So adding all that together is going to help to reverse some of the sun's damage and also be protective at the same time. When someone's 40 years old, the sun the damage that they're seeing is something that they actually got when they were in their 20s. So even if you're 40, 30, 50, and you're now just starting to see some of the sun, well, you don't need to add on. You don't need, you don't at least retard it to what you had gotten in the past, and then try to prevent anything in the future.